Okay.
That's why I told you.
Is it live?
Yeah.
Oh, I guess it should.
So you're in that class that's at 5:45?
Yeah.
Bruh, I want to go to sleep.
Well, the one today?
Yes.
With Beyonce?
Miss Swanson.
Yeah.
I love her though.
Again.
She is so nice. I love
I
her.
told her, like, you switched it on me and I got kids. Like, our class is supposed to be from 1 something
To 2:15.
Yeah.
Are they letting you watch it live at least? Like
Oh,
I
it
do.
know.
was 1 to 2.
But I couldn't come last week because my daughter has epilepsy, so she had a seizure at school. So then
Oh.
I emailed her and told her that, but then I was like, I don't know what to tell you. I'll be there. I did my homework. Like,
She's very.
I watched the video.
She's very
She's very understandable.
Yeah.
Especially because it got switched at the last moment.
Because it was a 2-day
Yeah,
class,
literally.
but it
I know.
interferes with that
And
social
her
work
class
and
is
healthcare.
literally-
I
her
dropped
class
that
is
class.
literally like this class. She makes it
I
like-
used it, after
she makes
practice.
it
I was
fun,
so.
interactive.
Oh, you just took a
It's
W
not
on it.
just, old guy.
Remember, I had I couldn't, bro. I couldn't do it, and then I was like, "Dang, jokes on me." This class ended up being 5:45 to 7. Better have been 8:30, but
Hopefully.
I was like,
It's no, that's not the problem for me.
There's
I
nothing
did
on
the
here.
discussion
It's
about
fine.
early
You can
today
go.
'cause I
"Hey,
worked
that's even
It
better."
films it and saves it, and you
I was
submit that
prepared.
link
I
into your
like, I don't know
submission.
people 'cause they didn't do theirs until Thursday.
Doing
So I was
mine
like,
on something I
"Well,
actually
like,
have. So
Okay.
I'm like, that's what I said. I want to reply. It's not my fault they waited till 3 in the morning. I'm supposed to stay up. Like, I'm supposed to stay up so I can reply before 10 o'clock in the morning. No.
So, y'all ready for a presentation?
Yeah, sorry.
No, that's
hey,
okay.
take y'all's time. I don't like presenting. I don't like presenting at all.
We do have at least 34 more minutes, so take your time.
Okay, well, I'm doing mine on anxiety disorder. One is anxiety disorder and facts about it. Anxiety disorder is a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. It can be a normal reaction to stress. Anxiety disorders increase risk of health complications. Anxiety and depression are linked, and anxiety can cause anger or irritability. Causes and conditions. Anxiety can cause intense, excessive, and persistent worry and fear about everyday situations. Fast heart rate, rapid breathing, sweating, and feeling tired may occur. Anxiety is an indicator of underlying disease when feelings become excessive, all-consuming, and interfere with daily living. Difficult experiences in childhood, adolescence, and adulthood are common trigger for anxiety problems. Going through stress and trauma when you're very young is likely to have a particularly big impact. Experiences which can trigger anxiety problems include things like physical or emotional abuse. What can a social worker do to help? They may help you to explore your situation and see how you may react differently with it. They may teach specific stress management techniques as well as discuss ways of managing overall stress, and they may help you to process emotions that are interfering with your functioning. It's like a little 3-minute video that kind of just like describes anxiety. I don't know how loud this is about to be.
Generalized anxiety disorder, GAD, is a very common mental disorder characterized by excessive, difficult to control, and often irrational worry about everyday activities. The worry is persistent and typically encompasses different areas of life, including work, health, finance, family, and relationships. Patients have hard time with daily tasks and often present with psychological as well as physical symptoms such as restlessness, muscle tension, digestive problems, headaches, and sleep disturbance. The mechanism of GAD is not well understood. Some evidence suggests that GAD patients may experience persistent activation in areas of the brain that process stimuli associated with fear, anxiety, and emotions. Dysfunction of brain pathways involved in anxiety, such as serotonin and noradrenergic systems, is thought to be responsible. Development of GAD is likely due to a combination of genetic and environmental factors such as significant life changes or traumatic events. Women are somewhat more affected than men. Other risk factors include lower level of education, chronic illnesses, and other mental disorders. Diagnosis of GAD is challenging. Patients must be tested to rule out other medical conditions, psychiatric disorders, or use of substances that may produce similar symptoms. Diagnostic criteria published by the American Psychiatric Association include excessive anxiety occurring for more than half of the time and ongoing for at least 6 months. The anxiety is difficult to control and is associated with at least 3 of the following symptoms: restlessness, fatigue, difficulty concentrating, irritability, muscle tension, and sleep disturbance. The anxiety results in significant distress or impairment in social and occupational areas. Symptoms are not due to other conditions or substance abuse. The GAD-7, a questionnaire of 7 items, is usually used as a screening tool and for severity assessment. Greater GAD-7 scores indicate greater severity. Treatments are most effective when combining lifestyle changes, psychotherapy, and medications. Lifestyle recommendations include identifying and removing possible triggers, eating healthy, practicing relaxation techniques, improving sleep, and doing physical exercise. Medications include antidepressants, anti-anxiety agents, and benzodiazepines. Selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors are considered first-line therapy. All antidepressants should be tested for optimal dosage and taken for at least 4 weeks to determine efficacy. Patients must be monitored for adverse effects. On the other hand, benzodiazepines are generally prescribed only for relieving acute anxiety on a short-term basis because of potential risk for misuse and dependence.
It affects the amygdala. I can't even say it. The one that it showed. Amygdala? Something.
And my work started. And that's it.
Any questions about anything? School can give you anxiety too, right? Especially when they change times of classes that they say they're going to be at a certain time and they're like, nope, just kidding. But we didn't want to cancel them because then people would be really screwed to graduate, I think. Anybody needed those to graduate? The ones that we had at lunch and it changed to 5. And then
I need it, but
Yeah, I do.
stressful. Cool. For your final, remember APA does references and then what'd you say? To keep us accredited. So you skip a whole day of your graduate school and save $20,000 and a year of your life back. I sure wish I had finals in social work when I was your age. Must be nice.
There you go home, start papers and presentations.
You know, it's only all about you too. Your final is about you. If you looked at it in the syllabus, it's literally writing about you, self.
I like that though.
I know, it's like simple.
We don't got to present, do we?
Nope. And then using
6
like,
pages.
it's like 5 to 6, yeah.
We can like talk about this stuff.
How much is worth?
You will fail if you don't turn that in.
Really?
I mean, there's not many assignments in this
Yeah,
class.
not really. But
No,
6
for real.
pages is a stretch.
Well, just use Corey or new font, right? I'm serious. No, you will knock this out of the park. You'll start writing and be like, damn, I want to write a book about myself.
Well, if it's about myself, I'm just going to be.
I'm cute.
Right. Right. Oh yeah,
When you go to the grocery store, you
Blake.
can buy some chips, okay?
chips.
To bring to work for us.
Wait, for what? Chips are freaking expensive, man.
they
Like
are. Why are they $3 a bag? $4 a
everything
bag.
in the world is expensive. Anybody want a foosball?
What is that?
Well, here's the ingredients.
It got peanut butter in it.
I don't know. Oh, you're allergic to hazelnut?
Oh yeah,
I'm
allergic to peanut butter. Nuts. Like I can't have too much of it.
You can have a foosball.
I can have one.
Yeah.
They say
Calm
vegan.
down.
Just don't be double dipping in there. Yeah, don't be double dipping, like
They say vegan.
licking on them and shit.
Like no one's gonna lick your stuff. I submitted it to D12.
Oh, okay. I'm sorry. Focus, right?
Well, since we ain't got no viewers, I mean, we could.
Oh, is there some?
No
Okay, because we ended the last class.
So they probably just log off.
Right.
Uh,
It is. Wait. Oh, it has one little. Oh, you found it. Okay, one little
Yeah,
spot.
because I'm like,
Is this it? You want a foosball?
They don't need no food.
They're vegan. Anybody a vegan?
nasty.
Are they nasty as hell? Is they're so healthy they're nasty? She hates it.
Girl.
Did you just take one? Did you take one or like a bunch? You're like, and you hate them, don't you? Where are you at here?
So I turned this in on D2.
Correct. So
probably all the way at the bottom.
page 2.
Blakey, yeah, probably.
Anybody else want a foosball?
Yeah.
Have you had them before? You want a foosball?
Yeah, I brought her for her birthday.
You believe that crap is normally $6?
$6 for that?
$6 for that little. That's like.
I brought her to school and my feet locked for Christmas butter.
Would you pay $6 for that?
No.
Did he try it? Don't be scared. You eat vegan stuff, and
Okay, so hi y'all. I'm doing mine over attention deficit hyperactivity disorder. We all know that by ADHD. It is an illness or deficit of nervous system. Kids with ADHD act without thinking and are hyperactive and have trouble focusing. They may understand what's expected of them but have trouble following through because they can't sit still, pay attention, or focus on details. ADHD is a common behavioral disorder and has been known to affect about 1% of school-age children.
do I go down or do you want to
Yeah.
just?
Oh, I
Okay.
will read off this anyway. I read that slide.
Sorry.
Yeah, okay. Okay, so ADHD behavioral and physical characteristics. Having difficulty getting organized, procrastination, incomplete tasks, impulsive and spontaneous decisions, getting bored easily easily distracted, impatient, overdo things, quickly frustrated. And to continue on, they have low self-esteem, involuntary speech or action, solitary learning, easily depressed, unconsciously careless, often prefer physical action to work off nervous energy. And then the causes. There is no exact cause that has been found, but there are a variety of causes that may be responsible, such as environmental factors like drugs or alcohol. Also, cases of it may be genetic. And then, ways social workers help those with ADHD. They understand the symptoms of ADHD first, consider pointing clients towards many treatment options, address the entire family, provide a necessary self-esteem boost. And then we have a video right here. Click it. Do I click
You
this?
can open like a new tab. That would be.
Okay.
That should work. Of course, it doesn't open the tab. Like, why would you open a link to the new tab and then not open the damn tab? Because they're drinking. I already got my panels up. Any questions?
I forgot to put my reference. I
References?
just tried to
You
hurry.
can put it in before you turn it in.
Okay. So like
Um,
resubmit it again in the same link.
Right, you can do that. Yep. Do you guys have any questions about life, about graduation, about your check sheet, about registration, about? Do they really give you $400?
No, I don't know.
They're lying?
It's supposed to be in November, but what's up with the enrollment clearance thing? It's not working.
I don't even want to think about that. I wish I had an answer to that
Yeah,
question.
so
Okay, so
You get $400? Can I have 50 cents if you did?
I got you.
like stop
Yeah.
asking for the 50 cents.
When I get it, I'll give you 50 cents. I'll give you that.
yeah.
Silver quarters too.
So I have to take those classes from List B.
Who's Lisby?
List B is in the academic
List
catalog.
B.
List B.
Yeah.
I thought you were saying like Rigsby was our last department chair who died of coronavirus 2 years ago. Yeah, he died of corona. I was like, Rigsby, is he like teaching from? He created an online module and then,
Yeah.
okay. Is List B like social sciences?
No, and that's the thing, it's not even. Like,
Natural sciences?
no, honey.
People
It's,
just classes that
it's like a
start
bunch
like
of,
Drama?
yeah, like drama classes and stuff. Like, I don't want to take that.
Take walking and yoga.
Public
and-
speaking?
I'm in yoga.
Yeah,
I
yoga.
already took that, but that was
I
a
didn't go to
requirement
that.
that I had to
Girl,
take.
nobody good.
I was saving classes for my senior.
Right.
Ain't that
They
easy?
just
You
go.
can go walk and go to yoga.
Basket weaving?
I ain't gonna- I know.
Let me
Listen,
go
it's-
to the hard stuff.
look at my classes. I don't even know.
Beer making is the best class I've ever seen.
And I think I got a lot of term A and term B's or something because
Oh, you already registered.
yeah,
Like, what can they
Yeah.
do?
because I got the minor in criminal justice. I don't know if those classes are hard, but I took most of my social work classes. I can't take Gen 3 yet. They wouldn't let us add it.
Oh,
Yeah.
I'm gonna take this one class. I'm not gonna lie.
you
I
can.
didn't I just want to get my hair.
Yeah, I know. Do you have to go
But
underwater
I
if you
don't know, 'cause
swim?
that'd be unfair, 'cause I'm not getting more than
My
10
major
feet.
social work and
If you wanted to add 3, we could walk over there someday when we have time. and add you.
Okay. And what would I get rid of? What's
Oh.
because I would get rid of something.
If you don't need something, but I mean, it's just.
These are the required courses. The only thing I got on here that I really don't need is
Aren't you way ahead of schedule?
yeah.
How many of you guys are ahead of schedule and how many are behind schedule?
Boy, they got
I'm
me.
not behind,
Just
I'm
off
not
my-
behind.
Because you need 61 hours to be a junior.
Mine transferred 60 or more.
But if you only transferred 60, they'll qualify you as a sophomore too. If 61, it's kind of stupid.
They
Doesn't
said I
matter.
have,
It doesn't matter.
Once these credits from Wilberforce transfer over, I'll have to be.
Okay.
It's like annoying. It's like I'm not a freaking sophomore, I'm a senior. But
Are you a senior? But wait, you'll have 58? Because you should have 90 as a senior.
yeah, I'm supposed to be a senior, but COVID sent me back. So
Oh,
all my
okay.
credits transferred. So I'm supposed
So if
to-
you had 60, you took 15 now, and then
They only get 19, 18 next semester. I was like,
you can ask for overload, but they usually make you have a really good GPA to do overload is 21. That's hard to do too. I probably shoot myself.
Yeah, I'm not doing 21 credits. That's
No.
They tried to say I was still enrolled at Wilberforce. That's why they didn't accept my transcripts I sent over. And I sent out a letter of non-attendance. I had to send that here, and they got it, and they still haven't.
So they're almost as bad as us with,
Yeah, yeah. No, but Central is Central's fault. Central hasn't
oh, it's Central.
accepted my transcript yet.
That
And
is
I just
annoying.
submitted all of them. And so
At
now
least
I-
they'll let you take classes though. Sometimes it'd be like, nope, you can't even enroll until
Is
you,
class over?
if you wanted to be.
I'm gonna see you all weekend.
That is
Like,
true.
me, right?
But I'm gonna have kids. You guys, nobody understands. I'm there is like, yeah, we're gonna have. I mean, I can't just like leave them at
Your wife's
home.
coming?
Yes.
Oh, yeah, so we're gonna meet
Like this is her only break.
you and kids can
And so if
play.
I left her at home all weekend, hell no.
Are you guys staying?
Pregnant and I watched you, baby.
Are y'all staying in the hotel too?
So like I'll come at like